Good day and welcome to the Foundation for a Healthy Kentucky conference call. Today's conference is being recorded. At this time, I'd like to turn the conference over to Rochelle Seeger. Please go ahead.
Good afternoon, everyone. This is Rochelle. I'm here in Louisville, Kentucky, where we have a really hot summer afternoon. But I'm thrilled you're joining us today for our Health for a Change webinar titled Food in Kentucky. We have three fantastic speakers, and my apologies for not coming up with a more creative title, but when you hear their presentations, you'll see why we are all here today to talk about these exciting things that are going on in Kentucky around food and food access. As you may know, the Foundation for Healthy Kentucky's mission is to address the unmet health care needs of Kentuckians. We do that by a number of ways. I work on the data initiatives here at the Foundation for a Healthy We do that by developing and influencing policy, working on access to care, reducing health risks and disparities, and promoting health equity. I do have a few save-the-date items I want to share with you this morning before we get on to the great speakers we have today. The next Health for a Change webinar will be August 2nd, and we're going to have the team from the University of Kentucky Injury and Prevention Research Center and Dave Hawkins from the Casper Drug Overdose Data, the Prescription Monitoring System here in Kentucky, will be sharing with us their work on August 2nd. Next up, on Monday, September 25th in Lexington, Kentucky, we'll hold our in-person annual Health Policy Forum, and the topic this year will be a substance abuse crisis. And finally, an event that I'm working on in partnership with Interact for Health, the Health Foundation in the greater Cincinnati area. We partner on this event to have the data forum. So all of those data lovers in the audience, please mark your calendar for Monday, October 23rd. We'll be up in Erlanger, Kentucky, in northern Kentucky. It'll be a great event and have some fantastic speakers lined up for you there as well. All of the Foundation's work, our reports, our data, and also these Health for a Change webinars are posted on the Foundation's website, healthy-ky.org. And a copy of the recording and the slide decks from today's webinar will also be posted there, probably by the end of the week or early next week if you want to share that with your colleagues. Now I'm thrilled to turn the call over to Anna Chang with Concept Hatchery to talk about some of her work. Anna, go ahead.
Hi there, everybody. I'm Anna Chang, and I'm an insight and strategy consultant and the founder of Concept Hatchery. Last year, we partnered with 1,000 Days, a national advocacy organization that promotes better nutrition for women and children under the age of 2 all across America. We wanted in this research to get a snapshot of what was happening and hear some of the stories behind why we were seeing the kind of behaviors we were seeing in the quantitative data which is available. To deepen our understanding, we decided to work in 3 states, Kentucky, California, and Mississippi, and we visited over the course of this a total of 19 moms. This is qualitative research, so we really focus on trying to understand a few people well rather than to get quantitative data through a lot of people. We look for a spread of different demographics and psychographics, and we spoke to them about the lives they were leading and the way they fed their children and how they came to those decisions. We were in their homes to witness meal times or snack times. We had them give us kitchen tours, and we also had the families keep food journals so that we could get a glimpse of their day-to-day lives. And to get a spread of the experiences, we also saw a range of incomes. We looked for 3 categories of people: people who were living at or above the living wage for their city, at or below the federal poverty level, or the people who kind of fell between the gap on those. So they were neither making enough money for a living wage, nor were they able to qualify for all of the benefits that might be available. In this first section of the research, we're just going to unpack some of the major themes that emerged around the mom's mindset, kind of across all of these categories. We started noticing fairly quickly that all the families that had babies and toddlers that were starting on equal footing when they were born because they were either being fed formula or breast milk, But as soon as they started transitioning off of baby food and into adult foods, that nutritional value started diverging very, very quickly. The first taste of food that babies get are really often what the family eats. They're not specialized for babies. And so the taste preferences are established really early. Even as young as at 4 months or younger, babies might be given like a finger that's been dipped in soup that the family is having or a lick of ice cream, and that just depends on what's already around in the house. So however well that family ate, that's how well that baby is going to eat as it starts growing up. The bottom line we learn is that early childhood nutrition happens entirely within the context of family nutrition. As one of our moms told us, which seems obvious after she said it, but we didn't really think about it, she said, I cook one meal for all. So while a mom might set aside some, for example, beans before that's cooked, but before adding spices for the rest of the family so that the baby can have something not spicy, they're actually not going to make an entirely different dish for that child. So it's critical that in our work we think about early childhood nutrition as a part of family nutrition. And this reminds me of something that I had heard last year when we were doing this research around a pilot program in Kentucky, which I hope I'm understanding this right, was providing fresh produce vouchers to the entire family when one person in that family was diagnosed with prediabetes. And I think that is actually entirely the kind of intervention that we need to start thinking about, because once food is brought into a family kitchen, it becomes available for everybody. It's not going to be, just dad's food or, just baby Jane's food. So we need to kind of address this as more of a family approach. The other thing we noticed was the prevalence of snacking, even from a really early age. And this kind of comes a bit from just the amount of control children have over what they eat. You might think that a 18-month-old can't really make food decisions, but he does, because if he refuses a meal, then the parents will try to make up for those calories later, and that's often in the form of snacking. So the snacks are often less nutritious, and it leads to this behavior of constant nibbling that leaves the children we met seeming just dissatisfied with their food all the time. And if we talk to the parents about it and ask them without looking at the food journal what their children ate, they would typically report on meals, not snacks. So they seem kind of unaware of this pattern of repeated snacking that would start to show up in young children. And in the case where a child is underweight, this problem is exacerbated because moms will prioritize high-calorie foods over nutrition. We see two primary reasons for that. The first is that they feel pressure from society. We like fat babies. We seem to think fat babies are healthy, and so if a baby is not fat, it's clearly not healthy. And then this is even made worse at pediatricians. The moms that we met who had small babies often told us that the pediatricians would give them pressure to keep the baby's weight up, and the metric of success they're given is purely a weight goal. So in the pursuit of this goal, building proper eating behaviors and providing nutritious diets becomes sacrificed because parents will feel like they need to feed their children high-calorie food. So even things like donuts or Danishes, we heard from parents who were telling us, well, I know this is not good for them, but I've been told I need to get his weight up. Add to all this kind of complex picture this added challenge of sleep deprivation. It's just tough in the first year of a child's life. The mom's not getting rest, and so making plans and thinking about how to change habits is actually really hard. So where we did see families who were able to make a positive transition in nutrition, they actually made that decision prior to the arrival of the baby, like months in advance, and had started forming new nutritional habits for themselves while their lives were still relatively stable. And so when the baby was born and things got hectic, those habits were already formed and they didn't have to figure out new ways of doing things. And then as soon as the baby started eating solid food, they were essentially getting the same food that the family does. So in light of this, I really want people to start thinking about, how do we focus that nutritional advice and learning in early and mid-pregnancy rather than in the first few months of the baby's life, because that's a more effective way of reaching a family, a mom in particular, at a point where she's receptive. In this next section, we're going to talk a little bit about the impacts of poverty that we saw on nutrition. The first obvious thing is around transportation barriers. Even for any of us, if you have children, you know how hard it is to go to a store with even one or several young children. And so income already makes it hard enough. But if you add to that you might have a car that's unreliable or no car at all, the store that's actually only 2 miles away might as well be 20 miles away because you can't get there with young children. You might have to walk, and there might be unsafe neighborhoods. In this quote that you see here, the cost of public transportation was really expensive, and so it makes it difficult for families to get where they need to go just to buy food for the week. Another thing we saw was a lack of safe storage or cooking space. In the top picture, you see a plug-in burner. We visited a family in Oakland, California. They were actually making $35,000, but in California, Northern California, that doesn't get you very far. So a family of 5 was living in a single motel room, and there was obviously no kitchen. The kids slept in a closet that didn't have windows, and they cooked on this rice burner and so a rice cooker and this electric burner. Of course, the kids all 3 of them are under the age of 5, so that's a serious hazard for the kids. In the bottom picture, you see the food storage problem. We met a family in Fresno, California, and they had rats in the kitchen, and there was a broken refrigerator. And this refrigerator broke 2 days before we showed up, and they simply couldn't afford to throw the food away and replace it, so they just tried to eat their way through it. And if you look just to the right of that Pepsi bottle, I don't know if you can see it because it's a bit dark, but you see that kind of pink thing? That had shrimp, and they hadn't thrown it away. So food storage becomes a problem when families can't afford to replace food, and what they have for storage at home is unreliable. In almost every financially struggling family we met, we saw a pattern of food bounty and food scarcity that was tied with the arrival of paychecks and food stamps. So the diets were not consistent. The families would eat fresh foods when there was money and then processed foods when there was not. And this also led to kind of a unhealthy development of habits as you kind of went through these cycles of scarcity. These cycles are not always just tied to money. They're also tied to transportation. So, for example, we would see a family that had just stuffed all the stores they had with Costco products that they were able to buy because they had gotten a paycheck the same time their friend was able to take them on a grocery run. So they had stocked everything up. But then, of course, some of the things didn't keep, and so there were kind of food freshness issues later. The overarching theme that we saw for families who were living in poverty was just how precarious daily life was. Many of the moms we met were fine in the weeks that we spoke with them and met with them, but most of these moms would have stories about having to make a choice at some point recently between rent and food, or between paying for a cell phone and keeping the service, or having heat in the house. If you had one small breakdown, like a refrigerator breaking, for example, that you would get ripple effects throughout everything else in your life, way beyond what a middle-class family would experience. So, for example, you might have food that's not entirely fresh, and that gives the family some foodborne illnesses. So mom and dad might miss work, and the kids would need diapers, which they actually don't have costs for, and then they have to pull money for something else, and the cycle kind of continues. So when we were speaking with some experts who are working with low-income families in Mississippi, they described it quite well in saying it's like having spokes of a wheel. In poverty, there are just less spokes supporting the whole thing. So if one thing goes, the entire wheel collapses. We met a very passionate WIC counselor in Jackson, Mississippi, and she was telling us about her experiences with moms, kind of describing everything else going on that was affecting how she could talk about nutrition. She said, my moms are dealing with so many other issues. I had a mom say there are 15 people living in her house, so she didn't even have a place for her baby to sleep. And so this WIC counselor really understood when she could talk to a mom, and didn't even bother trying to convince moms to start breastfeeding when there's so much else going on that they couldn't actually even pay attention. She thought it was just more important to really understand the context so that they would trust her and be able to come to her when they needed help. In this next section, we're going to talk a little bit about the WIC and the SNAP feedback that we got. We recruited for families that were using WIC and food stamps, so we didn't focus our research on them. We did notice a few commonalities that I thought would be interesting for the audience here. The first is that it's really helpful when the food is accessible, and this seems obvious, but sometimes there's limitations on what moms might get. So, for example, in Wanda here, we met her in Maryland, but she had also lived in California and Kentucky, and noted how impossible it was for a new mom to think ahead enough to be able to soak beans, which was all that was available in California. So your WIC benefits would only get you dried beans but not canned beans, and she couldn't even use those because she kind of couldn't get ahead of the planning enough to think about soaking beans at breakfast for dinner. So in other examples, we heard about food that wasn't accessible because it was not things that they were used to. So, for example, in Mississippi, the WIC benefit was for powdered eggs rather than fresh eggs, and some of the moms we met didn't really know what to do with that. Kind of related to that is getting food that meets with the mom's standards. We were actually surprised at how careful moms were, even like when it really stretched their budget to the max. For low-income moms, like Kathy here in Kentucky said, she said, I know that beggars can't be choosers. But at the same time, she was actually foregoing some of her WIC benefits because she didn't feel like it was safe for her baby. She really wanted to get organic food, and sometimes she would let her cell phone lapse, and they would struggle with other issues, but she really wanted to make sure that she had what was right for her baby. So what we saw is that if the moms already had a high value around fresh, safe, and organic foods, it's actually a lot harder for them to use the benefits that were available if there were limitations on those benefits. We heard a lot of frustration about moms not being able to just sacrifice quantity for quality. So, for example, if the benefit called for 6 jars of conventional baby food, they wanted to get 3 jars of organic and make do with that, but instead they got none. We also saw that food stamps in particular would affect relationships. And this is the case with moms who had left there or were no longer with their previous partners. Since qualifying for food stamps required cooperation and coordination with a dad, some moms were reluctant to apply because they were actually more stable not bringing the dad back into the picture. Or in another case, it affected the relationship where a family couldn't support their 3 children and they couldn't qualify for food stamps, so they actually just told people they were separated just so that they could qualify to make ends meet. We saw a lot of families that were moving, and this was actually driven by the poverty. Sometimes they're moving so that they can get closer to relatives so they can try to find a more stable support network, or they might be looking for a better job, or like we see in California, there's a lot of migration with farm work. And when they move across county or state lines, sometimes they have to requalify again. And that requires getting papers that they might not have or getting in contact back at a state where they no longer live. Without kind of consistent phone service and transportation, sometimes this is difficult. And then in addition, once they qualify, often the benefits are different. So the kids no longer have access to foods that they're used to, and this was particularly a problem for moms when they had to switch formula brands because different states have different agreements on what formula is covered under WIC. So that was, we just talked really quickly through these major issues that surfaced in our research. When we look at the big picture, there's really just one thing. You only took one thing away from you that I think this is what I really want you to understand, and it's best summed up in this quote from a mom we met in California. I feel stressed and frustrated with the kids running around and screaming, and I'm going from here to there, and then I have to feed them, and I have no brain, and I'm trying to cook, but I can't do anything well. I can't concentrate on food. I make whatever is easier. This is really kind of the snapshot of what we saw around stress with moms. There's so many balls in the air, and particularly if you are unstable and having low income. The context of the mom's life is actually driving many of the food decisions that she's making. She's just trying to get through the day and keep her kids fed. And although a lot of the moms we met understood about nutrition and vegetables and all that, they actually just didn't have the time or the ability to focus on it. So the challenge isn't in knowledge, but it's in getting the strategies to implement. And so when we talk to people about nutrition, we really need to understand that it's just one of way too many considerations that moms must juggle around kind of her values of food, but also what's available and the everyday realities of money and the habits that she's trying to form. And then there's so much information out there. It's kind of like, okay, I have all this information, but they're conflicting. Which ones do I trust? So we just need to be aware of all this mental juggling that's going on. And the last word that I'm going to leave you with is a mom who is just her kid is just starting to get into toddlerhood, and she's reflecting on this. And she says it's only recently been realized that I should probably take into account my own sanity in taking care of this child. Sometimes moms just need to know it's going to be okay and that they're doing okay. And we need to acknowledge that they are in charge and they are making all the final decisions when there's just so much they care about and they can't control. Just making sure the moms are being addressed in a caring and understanding manner is the best thing that we can do to keep the door open for our ongoing conversation around nutrition. So that's a very fast run through of a much longer report. And if you have any questions, feel free to reach out to me at this email. And also keep an eye out in the next couple of months on the 1000 Days website. They'll be publishing a report, a more complete report of this research, and the slide deck will be posted later by Rochelle. Thank you very much. I'm going to send it back to you, Rochelle.
Anna, thank you so much for that presentation. And for everyone on the line, once I see that report come out published, I'll be sure to share it with you all in case you don't miss that opportunity to read the report in detail. Fantastic. And I think that perfectly sets us up for Martin Richards with Community Farm Alliance. Martin, I'm excited to hear about what's going on in your area. Go ahead, Martin.
Thank you. Yes, and my name is Martin Richards. I have the honor of being the Executive Director of Community Farm Alliance. Though CFA has been around 32 years, it's still often run into that people don't know the organization. And maybe within the food and health crowd in particular. So I want to take a few minutes to introduce you all to CFA. So there's our mission and vision there. At the heart of what we do is really helping at the community level, people, grassroots organizing, leadership development around the issues that communities in Kentucky face. We have from the beginning a focus on agriculture and family farming, but obviously, that and food especially touches everybody's lives. This vision statement was updated, maybe a decade ago, to really have that kind of focus on social, economic, and ecological sustainability. Again, a little bit about what we do. We do focus on policy as kind of the end goal because policy does have the ability to affect far more people than a little old or nonprofit like us can. But in the process of that, we also do what we call model projects that directly benefit CFA members and the communities. And we are a grassroots membership-based organization, but always with the eye of a model that can then be used to pass a piece of legislation either in Frankfurt or Washington that can benefit so many more people. So within the idea of food and health, CFA has worked on these, and I suppose it's probably a little over a decade ago when CFA began market development in West Louisville, and CASA, who is on this call, was instrumental in that work. And I think at that point, CFA realized the issues around food access, food equality, food justice. And it really resonated with our farmer members who have been battling those similar kind of issues over the years. And so I think we have incorporated that into our work ever since then. It's only been recently that we have kind of pulled a lot of this work and our programming work under the title of Healthy Communities Initiative. And that is where that we work with communities to really help them think about health. And when we talk about health, it includes the physical, economic, social, physiological health of individuals and communities. So, we help those communities, come up with an approach how to deal with health in their community, but also bring to them resources through CFA's programming, but through collaboration with so many other organizations that we work with. And, there's the Healthy Food Access Incentives. $, is one I'm going to talk about more in depth, but also the pharmacy program, the summer feeding program, walking programs, things like, getting people to think about, especially kids, about water first. And then, it's one thing to have access to fresh, healthy, local food, but learning how to cook it is another situation altogether. But before I go in depth, I want to talk, again, a little bit bigger picture, right? So, we work within a context of a lot of efforts that are happening around the state. All these are essentially networks or collaborations that are happening within the state that CFA is a part of. And I noticed that Tamara Sandberg, who's with Farm to Food Banks Association, is on this call. The Hunger Initiative, for instance, is a recent initiative by new Commissioner of Agriculture, Ryan Quarles. It's a signature issue to address hunger in Kentucky. And a little bit of that landscape, right? I think, at least within CFA and a lot of people, I think we still think of Kentucky as being a rural state in which agriculture does play a huge role in the state's economy. But we are about 50%, urban and 50% rural. But in a state that grows food, has farming as one of its core economic components, the fact that there are still people hungry in Kentucky is kind of mind-blowing. 1 in 5 Kentuckians are hungry. That's actually improved from last year, and thanks to Tamara and her work, that number has improved to 1 in 5. But still, the fact that we have hunger in Kentucky, I think, is what's really woken up the agriculture community to this situation. So for 25 years, CFA has been making the case that local and regional food system development is economic development. We have recently added the fact that if we improve public health, and especially from our work through nutritional health, that is also economic development. And there is numbers that are right there on the screen to show that. And it's continuing to make the case for that. I think folks at the policy end are always looking at the economics of everything. And I think it's up to everybody who's on this webinar to keep that front and center, right? That better health through nutrition, physical exercise, all of that is really a huge economic boost. So a little more detail about our programming. So about 4 years ago, we created the Farmers Market Support Program that largely came out of our work in East Kentucky and a number of counties that didn't have farmers markets, despite the explosion in Kentucky and nationwide in farmers markets. And folks really wanted help in farmers markets. So we created the Farmers Market Support Program, and it has 3 basic pieces to it. We help provide the technical assistance for those groups of folks, farmers who want to start a farmer's market. How do you organize it? How do you get structure to it? Rules and regulations. But the other 2 important pieces is the capital assistance that we have helped provide through a lot of collaborations. One is a market manager cost share. I mean, we and others have noticed that when a farmer's market has somebody dedicated to help making that market run, even if it's just part-time and seasonal, it makes a huge difference to that market. And that money for that kind of position is hard to come by. So we created a cost share program. It's a 50-50 with the community and the market kicking in 50%, and CFA and our funders doing likewise. And then the Double Dollars program that helps provide incentives for folks who are using SNAP, WIC, and senior farmers market nutritional programs to use their benefits at farmers markets. And, for us, we came at that because we saw the huge amount of money that comes in Kentucky from federal food and nutrition programs, and we saw this as a way to get that money to support local and regional food systems as part of that. So it's really about leveraging existing federal funds that come into Kentucky. So we launched that in 2014 with 6 markets, more than doubled in 2015. And then last year in 2016, again, it doubled to about 30 markets. We also began last year a collaboration with Bluegrass Farm to Table and the Bluegrass Double Dollar program that was focused specifically in Lexington around SNAP at farmers markets, fresh stops, and 2 retailers. So with new funding from the Kentucky Ag Development Fund, we began merging those efforts. That has been solidified for this year into 2017 under a new brand that we're all calling Kentucky Double Dollars. And you can see the expansion again for this year. So 27 farmers markets in 22 counties, 10 Louisville fresh stops in conjunction with New Roots. And fresh stops are a kind of unique and innovative approach to providing food access, especially in low-income neighborhoods. And Lexington has also the fresh stops with the Tweens Coalition. And then we're continuing to do the retails as kind of a pilot to figure out how do we build a structure for this kind of program that includes retail, which obviously is where most people get their access to food and potentially has the biggest impact on Kentucky farmers, which again for us is always at the heart of what CFA does. So there's just kind of how that happened, and we're happy to say that moving forward, we just have now $1.4 million in federal, state, and private funds to keep expanding this program. And as you see, it's Ag Development Fund, but we also have WellCare, healthcare provider, obviously USDA through a couple of their programs, and BD&T Bank, who continues to play a small but hugely important role in this work because they gave us the first $5,000 to make this idea happen. So I'm forever grateful to BB&T for being the impetus for this work. Again, the goals remain the same with the merger of these two things. Increase access for fresh, healthy food, increase sales to farmers, and to leverage these federal food and nutrition funds to support growing Kentucky's local and regional food systems. So now Double Dollars is really 2 incentive programs, and it's kind of split into the fruit and vegetable Double Dollar program and the meat, eggs, and dairy Double Dollar program. And the fruit and vegetables is focused on SNAP, WIC, and senior farmers markets. The meat, eggs, and dairy is primarily for SNAP participants to use their benefits that get doubled up in purchase of meat, eggs, and dairy. And we're pretty specific that we want those products to come from Kentucky family farms. So the last slide here, and I hope I haven't breezed through this too quickly, is just about where you can get more information about this. So the Farmers Market Support Program, you can visit it on Community Farm Alliance's website. With the expansion of the Kentucky Double Dollars program, we now have a separate website for that program. And then I always make the pitch, right? We are a membership-based organization that we rely on individuals to really support this work, to be involved, and help us move it forward. And so it's open to everybody. And our membership is kind of reflective of Kentucky. We have about 50% rural folks and 50% urban folks. Thank you all very much.
Martin, thanks so much. When I was organizing this webinar, I asked all the top people and had the opportunity to meet some people, and everyone, Anna and Martin and Asha, said yes. This is really exciting for me. Why? Because I know great things are happening in Kentucky, and also when I open up my email or open up my computer, I really see headlines of a lot of negative things. And I'll be honest, this webinar has really been inspiring. I'm so excited. And our final speaker this afternoon is Casa Heron with the Louisville Food Co-op. And Casa, take it away.
Thank you. Good afternoon. My name is Casa Heron, and as Rochelle said, I'm with the Louisville Food Co-op. And I wanted to start just by introducing myself a little bit more. I am a Kentuckian, born and raised in Richmond, Kentucky, in Madison County, just south of Lexington. And I've spent most of my adult life living in Jefferson County in Louisville. And upon graduation, I started my professional career as a community organizer with CFA. And so it was great listening to Martin talk about all the great work that CFA is engaged in, and knowing that I was a large part of the beginnings of that work. And that's the reason that I'm engaged in the work that I am, is because of the work that CFA does. I am a sustaining member of CFA and to encourage people to join the work that Community Farm Alliance is engaged in. But I'm also an urban planner, and so the work that I worked with CFA was helping to organize farmers markets in low-income communities in West Louisville and in downtown neighborhoods around the Central Business District in downtown. And that work got me really interested in how cities are developed and in urban planning. And so since then, I've had a very great opportunity to work in various roles in terms of supporting nonprofits, working as a consultant with nonprofits or serving as a board member. I worked in local government in Louisville Metro and economic development, and my work has always been around the areas where food and community development connect. And so the work that I'm engaged in with the folks with the food co-op is essentially making kind of two priorities, or that have been competing, make them marry each other and make them happen together. And so our vision, I thought I was doing the slides okay, but maybe not. Okay. So our vision for our work is to help increase access to good, local, and affordable food, while we're also contributing to our local food economy and providing a really stable market for local food. And we believe that we can do that by using cooperative economics to get people to crowdsource their funds, their dollars, their talent, and other resources to open a community-owned grocery store. Throughout the last few years in Louisville, we have seen, and it's across the country, we've seen changes in the supermarket industries that have forced closures of smaller neighborhood-serving stores. And Louisville is certainly not unique in that problem. And over the years, that issue has gotten worse. And we've tested out farmers markets in these communities, and there was some success with that, and there were also some challenges with that. And New Roots, which is one of our partners, came in and started organizing Fresh Stops that Martin referenced, which are essentially CSAs that people organize in neighborhoods, particularly in places of worship, churches, and other faith communities, and people pull their resources and order local organic food wholesale from local farmers. And so we wanted to continue to grow that. The Fresh Stops are working from May till late fall, but people want to continue to get that produce and want to get proteins year-round. And the Fresh Stops have been successful because we've been able to recruit 50 and 60 families that are ordering every other week in 15 locations across Louisville and Lexington and a couple other counties. And so we wanted to continue that work of folks knowing that they can pull their resources cooperatively, and that we have farmers who want to sell wholesale to these markets, and folks are enjoying the food. And so we wanted to continue that work and have a bricks and mortar location that would sell that same food. So we're in the beginning of our work. We envision a store that could do a number of different things, but the main thing that we're after is the business model. That we know that traditional capitalist models for food isn't serving a lot of people. And so we are really focused on bringing people together who don't have access to this food and really helping and supporting folks to develop a business model that would work. We imagine a traditional grocery store that people would see in other places that you could also maybe get you could have a banking facility, so we're looking at talking to a credit union about locating in our space. We know that a couple of the Krogers that closed really left a huge gap in pharmacy services, and so we're really interested in providing space for that. Having a deli or coffee shop in the location has been thrown out as well, but we are really focused on the organizing and know that the community will say what they want in the store. So the folks of us who are leading the effort, we have been working together for over 10 years at least on several projects. We are a very diverse group of people in terms of our backgrounds, and we all come from different neighborhoods. We have 6 neighborhoods that we're focused on where the store would be located. They're all either downtown neighborhoods or neighborhoods that are in West Louisville. The common thread is that all the neighborhoods have limited access to fresh food, and all of the neighborhoods have successful Fresh Stops. And so what we've been doing is what we know to do is to organize people. There are tons of resources across the country on co-op development. A lot of land-grant universities have cooperative centers in which they support cooperative development in a number of different ways. There are philanthropic entities, foundations that are supporting this work in a number of different ways, and a lot of different CDCs. And here in Louisville, we have a gap in that service provision in terms of helping to support social enterprises that use cooperative economics as the business model. And so what we've been doing is educating ourselves about successful co-ops who have not been successful. We've been reaching out to those regional and national service providers and doing all that we can do to learn more about what it takes to open a successful store. And we're organizing other community members to join us. So our work entails, so we have been, meeting for roughly about 18 months as a kind of a loose network of community advocates. And in the past couple of months, we just organized ourselves as a Kentucky nonprofit. It's called LACE for short. It's the Louisville Association for Community Economics. And we decided to incorporate in this way to legitimize ourselves, to make it more official, and to really raise funds and resources to help this organizing phase of the co-op development. We are partnering with Community Farm Alliance, and they're serving as our fiscal sponsor. And we're organizing our community in a way that will lead us towards a business plan for the store. So right now we have the first, on the slide, you'll see the first 4 committees that are active. The 5th committee, the Business Development and Store Operations Committee, is a committee yet to be developed, but as we dig deeper into our community organizing, we know that we'll have folks that have those expertise and folks that are much more interested in actually the nuts and bolts of the co-op. So thus far, we've had a governance committee that's helped us with our drafted bylaws and helped us with our Kentucky Nonprofit Incorporation. That work is being led by faculty and past students and some current students at U of L's law school. We have an outreach and marketing team that essentially is connecting with people and getting people involved. We've launched a website, and I'll have that addressed at the end of the slideshow. We have a survey that's gone out. We've got over 600 respondents to a survey that asks people more about their spending habits and what they would like to see in another store, what some of their desires are. And we've been having several community meetings. One we've had in at least all of the neighborhoods, and now we're focused on having these kind of family-oriented educational workshops that also function as a working meeting for our committees. And so we just tested that out for the first time a couple of nights ago, and we'll continue to meet monthly until the store opens, providing childcare and a family dinner so that people can participate fully in our process. And then we have a fundraising and finance team that essentially is helping to resource this organizing phase. It's been great to work as a collaborative of community residents, and a lot of us, as I said, have experience working together. But it's also very challenging to do this and not have a leader or shepherd, someone who's being paid to think about this and do this work on a regular basis. So our fundraising efforts right now are largely around us being able to resource a project manager or organizer that really helps to shepherd all of the folks that have expressed interest in wanting to see the co-op happen. And I'll get into our goals. So in the short term, like I said, we are really focused on hiring a person. That person would help us launch our membership campaign. So we're doing outreach with community and having these monthly meetings. And one of the things that we really want to land on is, what's the cost to being an owner of the co-op, and what are the benefits? And we want as many people around the table to help sort out what those things are. And then we would launch a membership campaign for the co-op. We also want to host a summit or a conference sometime in the spring as part of our co-op ownership membership campaign, and to use that as an educational tool. As I said, there are tons of folks around the country who have been doing this. We've been following several co-ops, one in particular, the Renaissance Community Co-op in Greensboro, North Carolina, and so we would love to see leaders in other parts of the country come and talk to our folks and inspire us to continue the work. And we're currently working with, again, students at U of L's in their business school who we've deployed to work on our feasibility and business planning. And so we met the first crop of students who will spend the next 6 weeks on a feasibility and kind of market analysis study. And then in the fall, we'll work with another group that will work with our business planning. But I want people to be clear and understand that, we're not, the way in which to successfully open the store and create a good business plan is not just to pay a couple of people to sit in a room and crunch numbers, but it's to use that business expertise and combine that with desires and the knowledge that community knows and owns, and to match that so that the business plan really reflects the needs and desires of community, as well as makes good business sense. So longer term, we hope to launch a capital campaign sometime next year that would focus on the actual building and financing of the store. Site selection would, then begin, and we would find a general manager or someone that would help us, really start planning out the store operations. We get a lot of questions from people that want to know, how much is it going to cost and where is it going to be located? And we are really focused on the people part of the business plan right now, is organizing owners, folks who want to invest in the store, and people who want to shop at the store. And we know that once we get a good cadre of those folks, that the actual location of the store will come to us in a way that also makes sense with our business planning. So there are a lot of different ways that we are looking at financing the store. As I mentioned earlier, right now we're in the startup and organizing phase, and we're really looking for public funds and philanthropic dollars to fund this kind of 12 to 18 months organizing and startup phase. And in the future, we will be looking at traditional loans and non-traditional loan opportunities to fund the store operations. We have come to understand that it takes about 3 to 4 years for a store to be, for grocery stores to be profitable. So we'll have to build that in. Not really sure about what the average loss is over those years, but we are cognizant of that and want to be sure that our financing plan reflects those needs. We have tons of partners that we're reaching out to, and this list is not exhaustive, and we'll continue to add to this. But another thing that we've learned from other co-ops is that it's really important to have this, we've been calling it a cooperative ecosystem of support, and we are creating that at the same time that we're creating the plan for the co-op. In other communities, they've been foundations that have, come to help lead a process like this, or a local CDC that's already member-led and has already got clout in the community that leads these efforts. And so we're a little bit behind the 8 ball in terms of us getting building our capacity to do this work and surrounding ourselves with partners that will help us do that. So hence the relationship with CFA to help us with our fiscal work. And then certainly reaching out to other co-ops for advice and following their successes and their shortfalls as well has been really good for us. I think I'll stop there. There are tons of other things that I can say. We have a new website that is still in progress, but we invite you to join or to visit that website and join our listserv. We have a survey that we're still asking people that if you live in Louisville, we'd ask you to fill that survey out. One thing that we've noticed about the survey thus far, we haven't totally analyzed that, but we know that of the 600 or so survey respondents, half of the respondents have been from people in those 6 target neighborhoods, and the other half have been from folks who don't live in those target neighborhoods. And we were excited to learn that because it's helped us to understand and positively share that we know that this store, this location will be a place that attracts a lot of different people, and it certainly can be a place that helps to desegregate our community. We live in a very segregated community, and we are looking for the co-op to be this culturally gathering space where people meet around food and other civic engaged activities. So I'll stop there and we'll take questions if people have them.
Thanks so much. It's exciting, Louisville Food Co-op. What a brilliant and cheerful logo, one. And I do have a question for you. If we wanted to, are you able to share the survey, say if someone in another part of Kentucky is looking at this, or are you willing to share the survey that you all are doing, or just?
Sure.
Should we go to the website and look at that?
Sure. It's a Google-based survey, so it's not anything very fancy. But those questions, we can figure out a way to share them in some other way. But the survey, yes, is on our website.
Excellent. Thanks. And for the crowd still on the call, if you have questions for our speakers today, feel free to chat those in. We have a couple. Anna, this one's for you. It's about nutrition and nutritional value. Is nutrition value a factor in discussions about food access? Anna, what did you learn from some of your research on that topic, nutritional value?
So we heard a lot of stories from Mom, and before I kind of launch into what we heard, I just want to remind people this is qualitative research, so we're really trying to dig into the whys rather than how much. But, that aside, we heard a lot more around people actually having the nutritional value but not being able to achieve it. The frustration was around that. I mean, even families that were not eating well, they often knew they were not getting where they should, and they had reasons for not being able to get there. And we had heard more about that than just simply like not understanding or not caring about the food, which we did hear about as well. And also just remembering that like nutrition is kind of relative. So, I mean, it's a little what do the people around you eat, and so they have an idea. Like, for example, some of the people we spoke with in Mississippi ate soul food, and so like healthy food was, beans and cornbread. But like in Louisville, one of the families we met, their healthy food was, like grilled chicken breast and steamed vegetables. And so, once you kind of set that baseline, the challenges around nutritional value is getting the kids to eat it. And so I think that, how do you get that food into your house? How do you get access to the food? How do you afford the food? Those are much larger challenges. Does that answer the question?
Yeah, I think that's very helpful. And I love the theme of expanding the conversation. Martin talked about collaboration. Martin, I know you set a slide for us here about how to get involved with you. If I wanted to get involved, do I just sign up for your newsletter and become a member, or how would I do that to get involved with the Community Farm Alliance?
Yes, certainly can go to our website, cfaky.org, and just learn more about it. And there's some more information, getting ready to some revamping of that shortly. But yes, becoming a member of CFA, and it's kind of a sliding scale. We suggest $30 as a membership. And then you'll receive email. We have a number of email communications that we send out to folks. And it's kind of an important time because we're coming up on the next Farm Bill. Next year will be a huge time for the country. The Farm Bill, for those who don't know, 75% of the Farm Bill goes to food nutrition programs. And if we want to see those at least maintained, we need to be active on that. And so we're trying to build membership and calls for action as that moves forward. And then just staying up on, the issues in Kentucky. And, of course, CFA, we have a Facebook site. And you can join us and get more information via Facebook. And we are on Twitter, and I don't use Twitter, so my staff is going to kick me because I don't know how to tell you how to use that, but we are on Twitter.
Awesome. Thank you so much. First of all, I want to thank all of the participants that were on the call today. We had a great crowd on there. Really exciting to see all of you on the call, see all of you in air quotes. I will be sending out a post-event survey. I would love to hear what you thought about the event today, and also to send me ideas on different webinars or different things you'd like to hear about in Kentucky, around health in Kentucky, or if you have something exciting that you're doing at your work. This would be a great venue. I invite you to email me and fill out the survey, and I'm happy to share that across our Kentucky communities. Here's my contact information. Martin, here's my Twitter handle. I'll tweet you, Community Farm Alliance. I tweet out of Kentucky Health Facts for the Foundation for a Healthy Kentucky. And here's our website and Facebook information for the Foundation for a Healthy Kentucky. Thank you to the speakers for sharing all of this exciting information. There's a people plan, there's collaboration, and there's expanded conversation around nutrition going on in our state, and it's very exciting. I thank to each of our presenters today for sharing their work with us. Everyone on the call, I wish you a wonderful afternoon. Rochelle Seeger with the Foundation for a Healthy Kentucky. If I can be of help in some way, please feel free to call on me. Have a good day.
Thank you.
And this concludes today's call. Thank you for your participation. You may now disconnect.